everyone. Thank you so much for joining us today. My name is Jackie Garlock, and I'm with the Community Technical Assistance Center of New York. And I'm delighted to welcome everyone to today's webinar, Runaway and Homeless Youth Programs and Access to Mental Health Services. I know some folks are still joining us, but as people are signing on, I will take a moment to orient everyone so everyone knows how to participate in today's event. Please note that upon joining the webinar today, you've been placed on mute. This is just to avoid any background noises that distract from listening to the presentation. If you'd like to activate closed captions for today's presentation, you can do so by clicking the button on your toolbar that says Live Transcript and then selecting Show Subtitles. I do want to mention that AI bots such as Otter AI are not permitted to join CTAC offerings. If you come across any technical issues today during our event, please chat to either myself or our host, Angelique, who is under CTAC admin, and she will be able to help you with whatever you need. Please also, are there any questions that come up during the presentation, we encourage you to put those in the chat box. You can click that sort of dialogue bubble on your toolbar at the bottom of your screen to open the chat feature. And we'll be collecting those questions throughout the presentation today. And Claudia, you can then just chat to the hosts and panelists, and we can take care of any technical issues for you. And then we are going to be offering one continuing education credit for today's presentation for those who are eligible, counselors and social workers. If you're eligible to receive CE credit, you will get an email in a few days, which will provide you with all the information needed to go and get the CE credits. And then the recording and the presentation slides for this presentation will be posted online within the next few business days. So I'm going to turn it all over to our presenters for today. We're really delighted to be joined by a couple of amazing folks from both OMH, OCFS, and OASAS. So Madeline, I'll hand over to you to introduce yourself as I bring the slides up.
Hi, everyone. Good morning. My name is Madeline Hare. I'm a Senior Director at the New York State Office of Children and Family Services in the Division of Youth Development and Partnerships for Success. And glad to be with you. Meredith?
Wonderful. Good morning. My name is Meredith Ray-Labad. I'm the Deputy Director of our Division for Children and Families here at the New York State Office of Mental Health. And I too am joined with my other colleague, Sam.
Thank you. Hi, everyone. My name is Sam Koala. I'm the Director of Youth, Young Adult, and Family Services at the Office of Addiction Services and Supports, and it's great to be here today. Thank you.
Hey. Great. Welcome. So I feel we can get started.
I cannot see the slides, Jackie.
Oh. Okay, hold on. Sorry, everyone. Let's see if that works. Great. Thanks, everyone.
Okay, so again, good morning. The purpose of today's presentation is to talk about Runaway and Homeless Youth programs and give a very broad general introduction to what they are, what they do, and who they support, and also start talking about some of the intersections between Runaway and Homeless Youth programming and behavioral health providers like yourselves. So let's get to it. OCFS, my agency, one of the things that we do is we support Runaway and Homeless Youth programs. We certify them or license them. We provide funding, and we also conduct monitoring of those programs and provide technical assistance. Some important things to know about Runaway and Homeless Youth programs and what makes them different from any other programming under the auspice of OCFS. The first is that Runaway and Homeless Youth programs are grounded in a positive youth development framework and that they are deeply embedded with harm reduction practices. So what does that mean? That means that young people's voice is really centered through the entire service delivery and program design. It means that we talk about things like natural consequences and not punishments, and really try to create opportunities for young people to belong and thrive. It's really important to understand that Runaway and homeless youth programs are 100% voluntary. What that means is that there's no custody transfer when young people access our programs. It is not possible to court order someone to a Runaway and homeless youth program. They have to choose to be there. They also can choose when they want to leave. So we hope that young people are working with their provider to make a plan and achieve goals, and that they leave the program because they are fulfilling that plan. But it is also very possible for the young person to say, I'm not into this anymore and I'm leaving. And that is totally fine. They can do that, even if they're a minor. I also want to note that most of our programs are designed for youth and young adults. We also have some programs that serve parenting young adults. So that might mean that one of our programs is fully occupied by parenting youth who are also runaway or homeless. Or it could mean it's a more standard program where 1 or 2 young people are able to stay with their dependent children. Some definitions here. The text on the screen comes from state law, so you're welcome to read that, but I'm going to go over them briefly in plain English. So what's the difference between a runaway youth and a homeless youth? A runaway youth is a minor by default who left where they're supposed to be without permission. So that might be a young person who left the home of their parents and the parents want them back. It might be a young person who ran away from foster care or any other type of placement, but they don't have permission to have left. A homeless youth, in contrast, can be a minor, but it can also be a person up to age 21 who does not have a place to be, where there is appropriate supervision and care for their well-being. So we often are asked, how can a young person be homeless? Sometimes youth are made homeless because there's overcrowding and they're asked to leave because they're the oldest. Sometimes there's an incident in the home and there's a court order, a stay away order for the young person, and then the court made them homeless. It can be a wide variety of experiences that render a young person homeless. Now, a lot of the way the Runaway and Homeless Youth Service System operates is guided by what we call the county plan. So each county where there is a Runaway and Homeless Youth program has a Runaway and Homeless Youth coordinator, and one of their jobs is to create a plan each year that guides services. In that plan, counties can opt to include homeless young adults in their definition of homeless youth. And if they do that, then the services in their community can be available for young people until they turn 25. And this is in recognition that young people's brains are very much developing. Young people still need a lot of support even after they turn 21. Runaway and homeless youth programs are also an option for young people who are a potential PINS respondent. So if the young person, their guardian, and the PINS agency agree, the young person can access respite in a Runaway and homeless youth program in an attempt to ultimately not have a PINS petition brought against them. And young people, minors who are sexually exploited or trafficked are also eligible for services in Runaway and homeless youth programs. So that's the population that we're talking about. What are some of the experiences of young people who are runaway or homeless? The source of this data comes from Chapin Hall Voices of Youth Count. It is an extremely comprehensive view nationally of the experiences of runaway and homeless young people. I definitely encourage you to look at it. What it tells us is that 1 in 10 young adults between 18 and 25 experiences homelessness in a year. And that 1 in 30 minors between the age of 13 and 17 experience homelessness in a year. We learned from that data that young people experience homelessness in both rural and urban settings. There are some differences in the rate, but it is absolutely a challenge in rural communities as well. The way runaway and homeless youth present looks different in rural and urban communities. In some of our rural communities, we see young people sleeping in tents, in RVs, in non-winterized cabins, in places not fit for habitation. But they have a lot of survival skills that they're able to use to try and stay safe. We also know that young people experience homelessness often more than once, and that the experiences of homelessness that they do experience are different. So for example, a young person who is homeless more than once might both experience street homelessness and couch surfing. Couch surfing is very common. That's when young people are staying with friends or family and kind of bopping around for as long as they're welcome. And once they're asked to move on, they have to go find another place to be. So they're not necessarily a visible population, but they are very much still housing insecure and homeless. So there's three main types of service models that OCFS supports. The first two buckets are the crisis services and transitional independent living programs, or TILPs. Those are primarily residential services. And then we also support non-residential services. Non-residential services can mean a lot of different things, but the most common types that exist in New York are drop-in centers. So those are places where youth are able to just walk in off the street. They can take a nap on the couch, have a warm meal, a shower, do laundry, connect with service providers like yourselves. We also offer street outreach where folks are either in a van or just on foot, going out to communities and looking for young people and trying to engage them. And we also have case management programs, which is a lot of housing navigation, might be mediation with the family to try and find a place the young person can return to. But those are the biggest buckets. And I'll talk a little bit more about the residential models. The first one being crisis services. There's two types of models that fall under that bucket. The first one is runaway and homeless youth shelters. That is a congregate setting. Typically, they're up to 20 beds, where young people who are runaway or homeless can seek short-term interventions. Depending on that county plan we talked about, they can stay for either 30 or 60 days without the consent of their parents or against their parents' wishes. And then after that, if they still need to stay in the program a little longer, if their parent consents, they can stay for up to 60 or 120 days. And the purpose of this short time period is for the program to help young people kind of stabilize after they left whatever they're coming from, set some short-term goals, and work on moving toward them. The default goal from this program model is return to parent. So that is always plan A, unless there's some reason where that's not possible or not safe. And in that case, the program would help the young person think about options B, C, and D. These are 24/7 staff programs. And the other model that we have under this crisis service bucket is interim family program, which is probably most analogous to foster care, in which a family has extra space and they say, we volunteer to host a young person. So they are providing the food, shelter, clothing, and then all of the supportive services and coordination is supported by an agency offsite. This is data showing where young people came from before they entered a crisis service. This is 2020 data. We have it at the state level, rest of state, and New York City. And you can see that there are big variations between the experience of young people in New York City and rest of state. So in rest of state, more than half of young people who entered a crisis service program did so from their home of origin, their parent or guardian's home. In New York City, it's a little bit more equally dispersed, where we have a good number coming from home, a good number coming from a friend's house, so that's that couch surfing. We also have a lot who are coming from other crisis shelters, so they're bopping between shelter to shelter. That tends to be only possible in New York City because in many communities in rest of state, there is only one shelter, so they can't move from one to another. The last bucket is TILP, so that's Transitional Independent Living Services. And again, there are two types of TILP models. The first is group residence. Again, that's congregate up to 20 beds, 24/7 staffing. And then the second is supported residence, which is apartment-based living. So that can look like two things. One is where an agency owns an apartment building and each apartment is filled with a homeless youth. And then there's usually one reserved on the ground floor for office space or programming space. And then the other is the agency has an office and then leases from landlords in the community. So they're a scattered site model, and young people are living very independently, no staff on site, but somebody from the program checks in with them daily. These programs are not available to runaway youth. They are only available to homeless youth, and they have longer lengths of stay. So again, depending on that county plan, they can stay for either up to 18 months or up to 2 years. And the default goal of these programs is to help the young person transition to independence, to live on their own. We have here another chart showing where young people come from when they enter a TILP. And again, big differences between city and rest of state. In rest of state, it's almost evenly split across parents' home. There is more from crisis shelters. We also see a good number come from the adult homeless system. So young people who are homeless between 18 and 21 or 24 can be served in either the adult system or the youth system. And our preference is always the youth system because it's designed to meet the developmental needs and stages of young adults. In New York City, 70% of young people who entered a TILP came from a shelter. And again, that's a reflection of the difference in resources. In New York City, they have more of a pipeline so that young people can start in a shelter, go home if that's possible, and if not, move on to a TILP setting. Runaway and homeless youth programs are designed to be low barrier, meaning there should be very few reasons that young people cannot access that service. Young people are presumed eligible for the service as long as they fall within the demographics on the program's operating certificate. So they have to be the right age, for example. There are, however, reasons that a program could deny access to an otherwise eligible youth. Those include that the youth is likely to cause danger to themselves or others, or has a need, a medical or mental health need that exceeds the ability of the program to meet. This is pretty common, especially around mental health. So runaway and homeless youth programs are not well resourced. They do a lot with a little, and most of them do not have mental health or substance use disorder professionals on staff. They cannot safely maintain youth who have high levels of mental health need in most cases. So if a young person with that type of need is referred to a program, it would be fair for the program to say, we're really sorry, we can't take you in because we can't safely maintain you in this setting. And then at that point, they would work with the county coordinator to try and find another option for that young person. So what happens when a youth's in a program? They get an intake, they get an assessment, and it all kind of culminates in an individualized service plan. The plan is developed by the youth with support from staff, where they set short and long-term goals and work with the staff to figure out how they're going to meet those goals. So the goals are the youth's, they're not the staff's. It would not be uncommon for a staff to say, I really think you should prioritize college. And the youth says, that's not it for me. We need to focus on this. And we go where the youth wants to go. It's a youth-led program. So the role of the program is to help the youth access resources that will help them achieve their goal, help them stay motivated and stay on track. The top 3 things that our programs provided to young people: food, independent living skills, positive youth development opportunities. So that would be things like, opportunity to join a sports program. Maybe they haven't had that before and the program can help set that up for them. The top referrals made by programs. So this is something the program can't do themselves, but connected the youth to in their community. The number 1 is mental health counseling. So there is absolutely a need for the young people in our programs to access mental health care. In some cases, they have a diagnosis, and sometimes they're serious diagnoses that need medical management. In many cases, they need support around general wellness and well-being. So our runaway and homeless youth providers really rely on you all to help meet that need for the young people in their program. And with that, I will turn it over to Meredith and Sam.
Thank you, Madeline. So now that we've talked about the Runaway and Homeless Youth Services, we're going to talk about the intersection between those services and behavioral health a little bit more. So behavioral health providers, which are inclusive of both mental health and substance use, may and are likely to encounter youth who are homeless or who have run away and need a safe place to go and to access their services and supports. Runaway and homeless youth programs are a resource for providers when they're working to support and help a homeless young person who's in crisis or immediate need, just like Madeline talked through with in terms of connecting youth to the services they need and helping them to make those referrals. And then on the flip side, behavioral health providers can serve as an important resource for runaway and homeless youth programs who are serving youth with a variety of complex needs. We know that many young people who experience homelessness or runaway experience trauma or behavioral health challenges that need intervention and support. Are the behavioral health services, which again include both mental health and substance use services, typically require parental consent for youth under the age of 18. So historically, for runaway and homeless youth, behavioral health services have been difficult to access. And runaway and homeless youth programs struggle to get youth services that they need. Which leads us to some changes that have been made to mental hygiene law, and I'm going to pass it over to Meredith to talk us through those changes.
Wonderful. Thank you, Sam. This is pretty exciting. It just so happened that these changes kind of coincided with our efforts to really start talking about what are homeless and runaway youth programs, who are the young people that they serve, what are their needs, and how it's important for the behavioral health system to be aware of those needs so that they could be a support to those young people when they're struggling with mental health or substance use challenges. Recently, in this last couple of months, we've been working hard to make some changes to mental hygiene law to expand the capacity for young people to consent for their own care when they don't have the ability to have parental consent for receiving services. And obviously, those young people are most often homeless or runaway youth or youth who are receiving services in the programs that Madeline so wonderfully explained in her presentation that are certified or approved through the Office of Children and Family Services as runaway and homeless youth programming. So starting August 7th, which is tomorrow, very exciting. We're on the precipice of this announcement, so it's very exciting. Young people will now have the ability who are homeless or youth in the certified and approved runaway and homeless youth programs to consent for their own behavioral health care. Mental hygiene law has been revised to change the definition of a minor who has the capacity to consent to include, again, homeless youth or youth receiving services in these certified and approved programs so that they could secure the necessary mental health and substance use treatment that they need when they don't have the ability to secure parental consent. And the other wonderful thing is concurrently at the same time, many of you might be familiar with the changes that occurred in public health law a few years ago through the Department of Health in partnership with the Office of Children and Family Services, which is that they did also amend their public health law to include the capacity for homeless youth and youth in certified and approved runaway and homeless youth programs to consent for their own health care. We have also updated public health law to include language that includes behavioral health services within the capacity for this population of young people to consent for behavioral health care as well. So both mental hygiene law and public health law have been modified and changed to include the capacity for the receipt of behavioral health care from both mental health and substance use providers in New York State. So it's very, very exciting. So the provider, of course, would have to determine the youth has the capacity to consent to receive such care. And so as with all mental health services, there's a need for the practitioner to determine that the young person or any person, an individual, even an adult, has the capacity to consent for their care, and then they can provide the services for that young person. So it's very exciting. We are going to be working very closely with the Office of Children and Family Services and, of course, OASIS in partnership with us to share this information broadly with our provider systems to assure that They are aware of their capacities to allow young people to consent for their care when they're identified as being homeless or in receipt of services through one of the OCFS approved runaway and homeless youth programs. And it's going to provide the system a lot more flexibility to really provide the critical necessary mental health and substance use services for this population of young people who oftentimes are in desperate need of receiving services that they may not have been able to get up until this point. So we're very excited. We also, next slide, please. Oh, great. This is the slide. I thought it was before the resources slide. Sorry. Thank you. One of the things that we really want to also start talking about and share with you is the need for behavioral health practitioners and runaway and homeless youth programs to start collaborating and talking about the needs of the young people that the programs serve. What are the types of services that those young people often need? How the behavioral health providers can partner to help support those young people in providing services in their areas. And we're going to do a follow-up part 2 presentation for all of you and others to show a wonderful program who has a great partnership, a runaway and homeless youth program with a local provider agency who is providing services to this population of young people. And they'll talk about what that partnership looks like, what those services are, and what the needs of the populations are of the young people that they serve. I think it's really wonderful when behavioral health providers really have an understanding of the unique needs of the runaway and homeless youth population. I think Madeline really outlined the nature of the population, as well as the approach of working with the population that's very successful and really works well with the population, that they're leading and guiding their care, that they're making decisions about what their needs are and how they're going to engage in services or engage in their programs to help them and support them in their future. Runaway and homeless youth are a unique population, and really having a good understanding of what works best and how to engage and how to serve them is really critical. And so having a close working relationship with runaway and homeless youth programs will really help behavioral health providers to understand how best services can be provided and how those needs could be met. And so this presentation will provide a wonderful example of what a successful collaboration looks like that could be modeled off of in other communities and programs throughout New York State. Next slide. So we just want you all to be just familiar with who are these certified and approved runaway and homeless youth programs. On the Office of Children and Family Services website, there is a directory that you can access to say, well, do I have one of these wonderful programs in my community? The likelihood is yes, and you should get to know who they are. So you can select your county and you can identify which of the varied programs that Madeline went through are available in your community. And so if you get a call or referral, you know who these providers are and that you know that they serve a sector of the population that now can consent for their own care. And receive services without parental consent under the law. Next slide. And for runaway and homeless youth programs, it's really also important for you to be aware of who are the mental health and behavioral health agency resources that are in your communities. Both OMH and OASIS have comparable, we call them find a program search functions on our websites through these links. The Office of Mental Health first, and then the Office of Addiction and Support Services are underneath. And they too, you can search for programs and services in your counties. You can also have an advanced search and identify them by age range or type of program. And this will direct you to the programs that are available in your area. Next slide, please. You should also know that, obviously, in addition to the provider system at large, the local departments of mental hygiene are also available for provider systems in figuring out how best to serve the needs of young people in their communities. The Conference of Local Mental Hygiene Directors provides a directory on their website for the contact information for your county departments of mental health and mental hygiene. And you can also go and look for what's called the single point of access, which is a individual who has a greater awareness of children's related services in the counties and can also help to identify what agencies or programs might be best suited for young people who can now consent for their own care. Next slide. Great. And obviously, both the Office of Mental Health and the Office of Addiction Support Services have regional field offices. So if for some reason you're still struggling and you still can't find resources or someone to help, and you really have a young person who's in desperate need of care, we also have staff in each of the regions that can help to identify the services and supports that can help you. And so these are the Office of Mental Health's regional field offices. And next slide. Are the field offices, the regional offices for OASIS. And so those links can direct you to phone numbers and contact information for each of the regional field offices in each of the 5 regions of the state. So at any point, if you need help, there's someone out there who can help. And again, having those local conversations with the provider agencies or with the counties in relationship to how best to meet the needs of the young people that you serve is always a wonderful opportunity to figure out unique and creative ways in which services can be levied for this population of young people who are very vulnerable and often need specialized care. So next slide. I think that's great. And then, of course, obviously, there's a myriad of other wonderful resources that that are available to you through all the agencies. And here is a list of them as well. If you have additional questions about our service systems and our programs, you can always check out these links or call these numbers. Great. I think that's all for the presentation part. And I think we have time for questions. And I hope that we answered all the questions already, because I saw some early ones and they were saying, well, how do they get services? How do they consent for care? And here we are. I'm glad that everybody thought it was good news. I see the hearts. Thank you.
Yeah, fantastic. Let me see. So looking at some of the questions that folks put in. So one person, I know you did go over this in the presentation, but someone was wanting to get a review of what the difference between runaway youth and homeless youth was.
Yeah, so runaway youth must be minors. Homeless youth can be minors or young adults. Runaway youth are young people who left a home against, or the place where they're supposed to live, against the wishes of the adult responsible for them, their parent, the placement, staff, whatever. And homeless youth do not have a place where shelter and appropriate care is available. If you are interested in unpacking that even further, I'm throwing in the chat a link to a webinar that goes through those definitions in a lot of detail with examples. So feel free to take a look at that.
Fantastic. Thank you so much. So we have some questions about the new rule. So some folks were wondering about whether youth that would be able to consent for medication management, as well as behavioral health, like therapy services.
So the ability to consent is exactly the same as it would be for an adult, right? The language that is now inclusive of this population gives that young person the exact same authority to consent that you or I have. That includes medication, hospitalization, outpatient, everything. What it does not cover is payment, right? Young people still might need to pay, and that might be a barrier. And if the young person is on their parents' health insurance, for example, there is nothing preventing an EOB or billing to go to their parents, so they should not assume confidential care.
Great. So they could still consent to care. They can't necessarily consent to, they can't necessarily control the insurance billing process.
Correct.
Okay, great. And So we have folks asking about special considerations, maybe for youth who have developmental disabilities.
So our Runaway and Homeless programs can and do serve young people with all levels of ability. There are young people with IDD concerns in the programs now. However, the program does have the ability, if they are encountered with a young person whose abilities are so impacted that they can't maintain safely, they could deny access or discharge a youth on that basis, that they cannot keep that young person safe or others in the program space safe. But categorically, there's no like prohibition on IDD young people being served in this setting.
Great.
And I just would add that, again, when providing, mental health or substance use treatment, there is a requirement on the part of the provider to be able to discern capacity of the individual to understand what they're consenting to and to be able to have the capacity to consent. And so obviously, for the purposes of the IDD population, that would also be a consideration for the ability to self-consent for care.
Great. Thank you for clarifying that. And I think that's probably really helpful for people. I'm wondering, so, and maybe there's links to other webinars about this, but folks were wondering if you could explain a little bit more in detail the types of service models that RHYs offers, so the crisis shelter group residency, drop-in, and then who is eligible and who is not.
I feel like that's a very broad question. So the purpose of today was a broad overview. If you go to our website, there is a written description about each of those. And then I think if you have more questions or specific things you want to talk about, I would invite you to contact me or my team, and we'd be happy to walk through that with you.
Fantastic. Fantastic. So someone asks, I know a youth can decide to leave a shelter at any time. What if a youth does not want to leave after 30 days or 60 days or once a program has been completed?
That happens with some regularity. It depends why they don't want to leave, right? If the young person says, I'm not safe at home, and there's, the program should be calling the state central hotline to investigate potential abuse, neglect, maltreatment. If they just like it because it's a great place to be, then they need to have that conversation with young people that this is a short-term intervention and you really can't stay. There are opportunities for programs to grant extensions on the length of stay, but there's a lot of nuance in that. It depends on the kid's age. It depends on consent of the guardian. There are policies that outline all of that nuance on our website.
Awesome. Thank you so much. I know that you mentioned that there are services for pregnant and parenting youth, but we have also a question about a youth moving with a homeless parent and how they can receive services as a family.
So so we're talking about a couple, like where they're both runaway and homeless youth parenting together.
Oh, that was not the
That-
question, I think, but
no?
I mean, think that that's an interesting question as well. I think this was for a young person who is a homeless youth, but then they are also with an adult parent, their adult parent.
Oh, sorry. So the program age is like the head of households. So if a teenager is homeless with their parent, that parent is the head of household, and they would go through the family homeless system, not the runaway homeless youth system.
Great, great. Okay, and then so does a homeless or runaway youth need someone to escort them to a drop-in center, or can they walk in on their own?
They can walk in on their own.
Great. Is there a way that the needs of LGBTQ plus youth are being addressed in particular?
So all of our programs are required to operate with non-discrimination, with no tolerance for harassment and bullying, that sort of thing. All of our programs are also required to complete training specifically on LGBTQ plus competency and cultural sensitivity. That is a legislative mandate, and it has to occur on an ongoing basis. It's not a one and done thing. And then in addition to that, we have some programs who sort of self-identify as having expertise in the LGBTQ community. And while they cannot deny access to a youth who's not part of that community, it sort of works out that young people self-select where they're most comfortable. And so they, in the end, almost exclusively serve that population.
Great, thank you. So we have someone asking, what resources can agencies offer to support young people who do not consent to services? Maybe many young people we work with do not consent to these types of services, and we're being told that we need to do more to support them and their caregivers.
Curious if that question is for behavioral health providers or for runaway and homeless youth providers.
I am not sure. We can wait, maybe Julia, if you want to clarify in the chat. I think both. Switch the
I
response.
can speak for runaway and homeless youth programs. They don't do work with young people without the youth's consent. It is a youth-led program, full stop.
Right.
Yeah, I'm not sure what type of services or supports we could do without a child without consent, but if they're looking for things outside of behavioral health services that might be available in the community that would interest a child, that they would be presented and then consent to, the agency can always reach out to the county to see if there are any other non-treatment support type options that could be levied to support the young person that they might be wanting to offer the child to see if they would be interested in something else. But that's the only thing I could think of.
I do actually need to revise my answer. The mandated reporting could be called an intervention, right? If you must engage in mandated reporting, then that happens sometimes without a youth's consent. And to Meredith's point, I hope everyone is familiar with your municipal youth bureau. There's one in every county. They offer positive youth development programming that's accessible to any young person up to age 21. They have a wide variety of offerings, and that might be kind of a softer offer to young people to participate in something pro-social that is not seen as an intervention.
Yeah, that's great. I also see someone in the chat suggesting things around peer youth advocacy, which I think is and peer youth services, support services, which I think is great. We have someone asking for just a little bit more information on the services available to pregnant and parenting youth.
In terms of residential programming, those programs would have to have on their operating certificate the ability to serve the dependent children in order for them to stay together. When that does happen, there are supports for the parent around parenting, right? What does it mean to be a parent? How do you parent your child safely? The young person who is a parent retains custody of their child, retains responsibility for their child in every way, but the program is there to help connect them to childcare resources, to nurse family partnerships, to things that will help them to be the best parent they can be.
And I just wanted to clarify also that even prior to this change in mental hygiene law specific to homeless youth or youth in certified and approved runaway and homeless youth programs, youth who were a parent with a child were already had the capacity to consent for care. So pregnant and parenting young people were already authorized to consent for their own care prior to this change. So no change for accessing treatment services for that population.
Great, that's great. Is there a specific consent for the youth, or is there something in their chart or in their paperwork that needs to indicate that they are runaway or homeless in order for them to consent?
There would likely need to be some verification or status of them being homeless or in an approved or certified runaway and homeless youth program. And they could get that from the program.
Great. And I also have someone in here saying, is there any difference if the youth left a foster home versus the home of their family of origin?
In terms of what service they can get in a runaway and homeless youth setting?
I
That
believe so.
is a little complicated because the rules for foster care are federally derived and the rules for runaway and homeless youth are not. So from the runaway and homeless youth perspective, anyone who fits the definition of RHY is eligible, including if a youth ran away from foster care. They are a runaway youth, but you cannot be homeless if you're in foster care because you have a place to go back to. So youth in foster care cannot access TILP services because those are for homeless youth only. They could access crisis shelter as a runaway youth until they're 18. But if you're in foster care between 18 and 21, then no, that's not an option for you because you cannot be runaway and over 18. That's
Gotcha.
runaway and homeless youth rules. The foster care rules are that young people in foster care must be in a certified foster care placement, which runaway and homeless youth is not. So it could be that a 17-year-old runs from foster care into a shelter, is served in that shelter according to RHY rules, and the county is quite frustrated that the child is not allowed to be there. And that is a tension that we help folks navigate every day.
And then they turn 18 and then things get even more, complicated, I imagine. Yeah, thank you. Yeah, so much nuance. Well, I appreciate it. I think it's helpful for people to understand those things. I'm looking through and I think that we have got most things. Oh, maybe one more. If the child has a goal of access to independent living, would they have access to a TILP?
I'm going to make some assumptions about this question. I'm assuming you're talking about a young person in foster care with a goal of APLA. Can that young person access a TILP? No, they can't. Because if they're in foster care, they need to be in a certified foster care setting. What I would suggest is if the young person is struggling with their placement, they might consider a supervised setting program, which can include community residents. We're now getting way off base from the purpose of this webinar, but I'm happy to talk to you about that online about what all that means and how to do it.
Great. Thank you so much. Anything else that you, Meredith, Sam, Madeline, that you would like to take any time to share with our providers? We also did have a question, I feel like at the end, maybe it would be good to wrap up about where people can find the language for the full new rule as well. But I also, before we do that, I think maybe anything else you wanted to say before we wrap up.
No, there was a question about another section of public health law, which states anyone who acts in good faith based on the representation by a person that he or she is eligible to consent pursuant to the terms of the section shall be deemed to have received effective consent. So thank you for that. We regardless, we will be issuing some guidance and some information for providers around the new changes to the public health law and the mental hygiene law. And we'll be able to, address this issue moving forward. I think that I know providers often feel like they want to have documentation, they want to have it in the record. But I think that, but we can provide clarity to our agencies about that. And I know the Runaway and Homeless Youth programs are very, have been cooperative and are really helpful when they have a young person who they've identified and referred to mental health services for making sure that the agency knows the status of that child. So I'm sure we can figure out ways in which to make this work.
Thank you. That came in after I saw the chat, so I appreciate that.
Yeah, no, that's why I mentioned.
Yeah, no, I appreciate it. I appreciate it. Anything else, Sam or Madeline, before we wrap up?
Nothing further from me. Just appreciate everyone being here.
Great.
I would just reiterate the invitation to part 2. So we talked very broadly and generally today, but if you want to hear a concrete example of what this really looks like every day, how folks work together, that's what the part 2 is about. So I hope you can join us there.
Yes, we're really looking forward to part 2. Again, that's on September 8th. It's from 2:30 to 4 p.m. Eastern Standard Time. And we're really looking forward to that as well. Folks, I know we're finishing a little bit early, so if folks could really make sure that they fill out our survey. Angelique is going to put the information in the chat. So please make sure to fill out our survey to, ask about other webinars that you would like to see from CTAC. And that could also be in our partnerships with OASAS, OCFS, and OMH, or it could just be general. And thank you so much, everyone, for joining us.
And
Thanks,
Jackie, I would-
Angelique, for putting that in the
So
chat.
folks are aware, they had asked where they can find this information.
Oh,
In
yes.
addition to the Dear Provider letter Meredith mentioned, OCFS is also going to be releasing an INF to the Runaway and Homeless Youth Provider community, and that includes a handout for young people to help explain this to them. So programs can hand this out to explain it to young people.
That's great. It seems that the link for the survey isn't working, Angelique. I don't know. It does work for me, so it's possible that maybe you need to be, I don't know, it works for me. So I'm not sure what's going on for some folks.
That's just a firewall issue.
Potentially a firewall issue, yeah. So yeah, someone said try a different browser. So we appreciate everyone's attempt to give us feedback. You're also welcome to be in contact with CTAC through Zendesk if you have any specific feedback as well, through our online email system if you would like to send any feedback that way. Okay, thank you all so much for joining us today. Thank you to Meredith, Sam, and Madeline. And we'll look forward to seeing many of you on the 8th for our part 2. Have a great day, everybody.